This special episode of Health Matters is sponsored by AstraZeneca.
This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're continuing our special cancer series with bladder cancer. We might not hear much about bladder cancer in our day-to-day, but it's actually one of the 10 most common types of cancer in the U.S. And while it may be difficult to diagnose, there are some very clear causes, which means there are very real steps you can take to reduce your risk. This episode, we're joined by Dr. Timothy Lyon, a urologist at Mayo Clinic in Jacksonville, Florida. He's going to walk us through what does and does not cause bladder cancer, as well as cutting-edge treatments and what you can do today to keep your bladder healthy for years to come. Dr. Lyon, welcome to the show.
Thanks. Very happy to be here.
Now, for those of us who don't think about our bladders every day, by the way, that's not me. I do think of my bladder every day. But for those who don't, what does the bladder do outside of holding the obvious?
Yeah, the bladder has really two functions, and that's both to store and to empty.
Mm-hmm.
So obviously the bladder is a storage organ for some of our waste product in the form of our urine.
Mm-hmm.
So importantly, it has a non-absorptive surface. So the things that are inside the bladder are not absorbed through the wall of the bladder into our system, since it's holding things that we're trying to get rid of. And it does a pretty good job at storing fluid at a low pressure. So it can expand, and for most adults can hold between 2 and 3 cups of urine at a very low pressure, which helps keeps our bodies functioning appropriately.
Mm-hmm.
And then, of course, when it's time to urinate, it empties itself and starts the process over again.
It's a miraculous organ. I mean, that waterproof membrane alone, that's just amazing. You normally have to go to REI for something like that, but it's right in our bodies, right?
You'd pay extra for that for sure.
So what exactly is bladder cancer and how common is it?
So bladder cancer, of course, is a cancer that arises from the inner lining of the bladder, so the part that touches the urine. And it's actually fairly common. About 85,000 cases of bladder cancer will be diagnosed in the United States in 2026. Unfortunately, about 18,000 people in the United States will die of it this year.
Mm.
And it's actually the 5th most common cancer among American men.
Now, is this urothelial carcinoma we're talking about here?
Exactly. So urothelium, those are the cells that line the inside of the bladder, and they're fairly special because they can expand and contract and are somewhat elastic, again, storing urine at low pressure. But it's those cells that bladder cancer usually arises from.
And bladder cancer can come in different forms, so let's talk about that. First, there's a distinction between low-grade and high-grade bladder cancer. What does that mean?
So the term grade means under the microscope, what do the cancer cells appear like? So we're really looking at different features of how the cells are shaped, how they're structured, how dense or not dense certain parts of the cell are. And we know that some of those features are associated with how the cancer behaves. So low-grade cancers, those look more similar to normal non-cancerous cells. And we know low-grade tumors are, generally speaking, relatively slow-growing and have a lower risk of invading deeper into the bladder or spreading somewhere else in the body. And conversely, high-grade cells are more likely to grow quickly and have a higher chance of progressing to invasive disease or possibly spreading outside the bladder.
And what about carcinoma in situ?
So carcinoma in situ, or CIS, as we usually refer to it in short, means cancer cells that have formed on that lining of the urothelium, but there's no invasion. So they're only in that first layer of cells. And that's different from how most cancers form, where they form tumors or masses or growths. CIS usually forms almost like a carpet or maybe like a puddle of water and spreads outwards or laterally along that lining instead of invading the structures beneath it.
Does that make it more dangerous or less dangerous than other types of cancer?
I would say it depends. Carcinoma in situ is by definition a high-grade disease. So I guess it's more dangerous than low-grade bladder cancer. But really the trouble for us as urologists and our patients facing this is it can be a lot harder to see.
Mm.
When we're evaluating someone for bladder cancer, it's relatively straightforward to see a mass or a tumor. But carcinoma in situ sometimes can elude our detection because it grows flat.
Let's talk about some of the causes or risk factors for bladder cancer.
So smoking is by far the number one risk factor for bladder cancer. In fact, about 50% of bladder cancers are related to smoking,
Oh.
tobacco products. And we're now learning that even some of these non-cigarette nicotine products like vaping and vape pens also have some of the same carcinogenic chemicals in them that could also lead to development of bladder cancer. So that's where most people get it from. We know that exposure to other types of chemicals can increase one's risk. So petroleum products or petroleum derivatives. So people that work on an oil rig or long-haul truck drivers that breathe a lot of diesel fumes.
Mm-hmm.
We know painters that are inhaling a lot of paint fume are at higher risk.
Mm.
Firefighters who are around smoke, people that work in the leather or dye industry. So certain occupational exposures can happen.
A lot of those things actually make me think of things like lung cancer, cigarette smoke, chemicals on the job, petroleum, and so on. Is there a link between the bladder and the lungs that makes both of them highly at risk for exposure to these chemicals?
You're absolutely right. A lot of the exposures that can lead someone to potentially develop lung cancer are also associated with the development of bladder cancer. But when you think about it, it actually kind of makes sense. Take cigarettes, for example. You inhale the smoke and it sits in your lungs for 5, maybe 10 seconds before you breathe out. But what happens after you've inhaled is those chemicals are taken into your bloodstream through the lungs, but then they're filtered out of your body in the urine. That's how they get out. So you make pee and it will sit in your bladder for sometimes hours at a time. So there's a lot more contact time and exposure to the bladder than there is inside your lungs with each inhale. And we think that's why there's a link between those exposures.
Oh, I never thought of it that way. Fascinating. How about age, gender, and genetics? How do those factor into someone's risk of developing bladder cancer?
It's primarily a disease of older adults. The average age of diagnosis is in the early 70s, 72. But that's not to say it can't happen to younger people. And unfortunately, I've seen patients as young as early 20s that have been diagnosed with bladder cancer. It's about 4 times more common in men than in women. We think that's due to some of the occupational exposures and cigarette exposures that are more common in men than in women. But unfortunately, bladder cancer tends to be diagnosed later in women than in men.
Why is that?
We think it's a detection problem. The most common symptom of bladder cancer that would lead one to be diagnosed is visible blood in the urine or red color of urine or maybe blood clots in the urine. And men tend to get evaluated fairly promptly with that symptom. But women are often diagnosed or told that they have a urinary tract infection, maybe given several rounds of antibiotics before they're referred to a urologist. If they're premenopause, maybe it's blamed on menses. So it can take longer for women to be evaluated and diagnosed. And for that reason, they're often diagnosed at a higher stage.
That makes sense. Not in a good way, but it does make sense.
And that's, I think, a very important thing to get across is that blood in the urine is never normal. And if you see it, you need to be evaluated by a urologist.
Are people with chronic bladder inflammation more likely to develop bladder cancer?
Yes. We know that chronic inflammation anywhere can lead to cancer development, and the same is true with the bladder. So chronic bladder inflammation is usually due to some type of foreign body in the bladder. So say people that require a urinary catheter and have one in there all the time, maybe someone that's developed a stone that sits in their bladder and rubs on the inside.
Mm-hmm.
People can get a parasite that can lead to chronic inflammation. So sometimes that can lead to bladder cancer, but we do not think there's an association between having urinary tract infections occasionally and bladder cancer.
Is there anything behaviorally speaking as far as how we control our bladders that might contribute to bladder cancer? For example, a lot of us have been told, don't hold your bladder too long, or alternatively, don't train yourself to go every hour on the hour. So is there something as far as our bladder behavior that might affect the cancer risk for our bladder?
I think probably not. I think we know that holding your bladder too long is not something that's going to lead you to develop bladder cancer. People that hold their bladder for a long period of time, maybe we need to be thoughtful about why that's happening. Perhaps they're driving long distances. Perhaps that's leading them to also not drink enough fluids, which could cause other impacts on their health. But I don't think the act of holding your pee too long in and of itself is a problem.
Got it. Bladder cancer is on the rise these days. Do we know why that is?
I'm not sure we know why exactly. I think it probably has something to do with the demographics of the United States. We have more people that are living longer and live into their 70s, 80s, and 90s, and eventually developing this disease.
Could there also be more cases now because we've just gotten better at detecting and diagnosing it?
Could be, but generally speaking, we don't screen the average population for the presence of bladder cancer like you would think about for a colonoscopy where everyone routinely gets one at a certain age. We really wait for someone to have a symptom like blood in the urine before we evaluate them.
So, if there's one thing you take away from this conversation, it should be that blood in the urine is never normal. While bladder cancer isn't the only reason you can have blood in your urine, you definitely want to rule it out. Risk factors for bladder cancer include many chemical exposures that happen through the lungs, like smoking or occupational exposure to chemical fumes. Chronic inflammation from having a foreign body in your bladder, whether it's a catheter or a parasite, also puts you at risk for developing bladder cancer. But we know bladder cancer is still hard to detect. So let's learn what other signs to look for and how to get diagnosed. Let's talk about detection and diagnosis. Bladder cancer is somewhat hard to detect early. What are some of the symptoms people might experience even if they don't realize the cause that might make them want to go to the doctor and get things checked out?
So certainly any blood in the urine, visible blood in the urine. If your urine looks reddish or has solid material that look like blood clots, that's something you should take seriously. And I think one misconception for many people that we see that have been diagnosed with bladder cancer is they tell us, I had blood in my urine for a day or two, but it went away, so I figured it was okay. And I think it's important to know that bleeding in the urinary tract is usually intermittent. It usually comes and goes. We should not be reassured if it comes and goes. I think if you ever see blood in the urine, you need to bring it to the attention of your doctor. Other less common symptoms may be really severe urinary urgency, feeling like you've got to pee all the time, pain with urination, and very occasionally back pain, but not in the middle of the back, on the one side or the other where the kidneys are located.
And so somebody out there listening, they're like, that sounds like me. They go to the doctor. What does the doctor do then?
Well, they may send some urine tests to look for common things that could cause that, like a urinary tract infection. And if that's present, completely appropriate to treat that with antibiotics. But if not, they should refer them to a urologist for evaluation.
And as a urologist, what procedures and tools do you have to detect potential bladder cancer?
When someone has a suspected bladder cancer, usually the next step in diagnosis is a procedure called a cystoscopy, which essentially is a urinary catheter with a small camera on the end of it that is placed into the bladder.
So it's going up the urethra into the bladder?
Correct.
Ah.
It's usually an office-based procedure that takes about a minute or so to do. And we look around the bladder and see if we identify any tumors. Carcinoma in situ sometimes can be hard to identify from the naked eye. So in select cases, we can do what's called a blue light cystoscopy. And this is pretty neat. It's a chemical that is placed in the bladder through a urinary catheter and dwells for about an hour. And that chemical is absorbed by cancerous cells in the bladder, but not by normal bladder cells.
So only the cancer cells like that dye.
Correct, exactly.
Ah.
And then when we shine a blue wavelength of light, it will cause any cells that have absorbed this dye to glow.
Oh.
It's almost like taking a black light to something, and you can identify shapes or stains that you might not see otherwise. So that's not used for everybody all the time, but it's an important tool for people that have known or suspected carcinoma in situ. We also have some urinary tests that can screen voided urine or urine that you urinate into a cup that may tell us whether or not bladder cancer is present.
So the cancer can be detected in the urine itself?
Yes, in some cases. So we don't want the fear of a cystoscopy to lead people to say, I'm not going to go see the urologist because I don't want to have this uncomfortable procedure.
Oh, that's fantastic. And let's say the diagnosis is, yes, this is bladder cancer.
Mm-hmm.
What does one's care team look like for treatment going forward?
So that depends on what we learn about the disease and the stage and the grade. Thankfully, about 3/4 of bladder cancer that are diagnosed are confined only to the bladder. So in that scenario, treatment is usually provided by a urologist. In more advanced scenarios where the cancer may have invaded or spread, the care team can often include other types of physicians, such as medical oncologists who give IV treatments or radiation oncologists.
And those teams would also possibly have a surgeon involved too then?
So all urologists are surgeons and are capable of operating to remove bladder tumors. And really, anytime we identify any type of bladder tumor, the next step is to go to the operating room for a procedure called a transurethral resection of a bladder tumor, or TURBT. This is generally done anesthesia, and it has two purposes. It's diagnostic and it's therapeutic. So we place a different type of scope through the urethra into the bladder, so no incisions or cuts on the body. And we use our surgical instruments to remove the bladder tumor or tumors if there's multiple. So that removing of them is one part of the treatment, and sometimes is all people need. And then we take all of that tissue we removed and send it for biopsy. And they will tell us about the stage and grade of the tumor, so we can then understand what may or may not need to be done to treat the person.
Hold on. So even during surgery, that's all just done through the urethra?
For initial diagnosis, yes.
That's amazing. I just think about how tiny the instruments are that are being used. That's incredible to think about.
It is. The biggest side effects of something like that type of procedure, most people will have a day or two of irritative urinary symptoms. They have bleeding in the urine, strong urge to pee, burning. And unfortunately, many patients will need a urinary catheter for a few days after that procedure to let the bladder heal.
Symptoms of bladder cancer can include severe urinary urgency, painful urination, back pain in the area where your kidneys are, and blood in the urine. If the blood comes and goes, that doesn't mean you're in the clear. Any blood is a concern. There are urine tests that can help detect bladder cancer, but the usual way to diagnose it is a brief in-office procedure called a cystoscopy. During a cystoscopy, the urologist will insert a small camera through the urethra and have a look around. If there's a tumor or abnormal cell growth, the next step of diagnosis is actually to just surgically remove the tumor with 0 incisions. Sometimes this is enough to treat the cancer altogether. But either way, the tissue is sent off to the lab so your urologist can learn more about the cancer and the best way to treat it. Which brings us to treatment. If the initial surgery isn't enough, what comes next? So, the surgical procedure that you use to diagnose bladder cancer may be enough to actually treat it for some people, but other folks may need additional treatments after diagnosis. Let's talk about some of those treatments. Chemical washes. How do those work?
So the bladder, as we said earlier, is a pretty unique organ in that whatever we put in it doesn't get absorbed into the rest of the body. So that gives us a fairly unique opportunity to treat bladder cancer by putting anti-cancer medicines into the bladder, where it will sit, treat the bladder cancer, but not be absorbed and cause side effects in other parts of the body. So most patients that have cancer confined to the bladder can be treated with chemical washes. And that's usually either immune therapies or chemotherapy medicines that are instilled through a urinary catheter. So they'd come to the office, a nurse would place a catheter, the medication would be instilled through the catheter into the bladder, catheter comes right back out, and then we ask the patient to hold their urine for an hour or two. And during that time, the medication's inside there doing what it needs to do to fight the cancer.
Oh my gosh. Wow. In the grand scheme of things, I know there's a catheter, but it's still so non-invasive compared to cutting somebody open.
Absolutely. Side effects just confined to the bladder. So people can usually continue working, continue living their life, doing what they need to do while they're being treated for bladder cancer.
That's incredible.
Yeah.
Wow. Let's talk about BCG treatment.
Yes.
Can you explain what that is?
So BCG is probably the most common and most effective type of medication that we wash in the bladder for treatment of bladder cancer. BCG stands for Bacille calmette-guerin, and it's actually a bacteria. It's a partially inactivated type of bacteria that causes tuberculosis in cows.
Okay, so you're inserting cow tuberculosis into...
Yeah, which is kind of crazy, actually.
It is. When you say it out loud, it sounds a little medieval.
But it's very effective. And essentially what it does is it doesn't kill the cancer directly, but when we put it in your bladder, it stimulates an immune response. So your body can bring cancer-fighting cells to the bladder and help fight off the cancer. And it has been shown to not only reduce the chance that cancer comes back, but it also reduces progression, meaning if the cancer does come back, it's less likely to grow roots or invade below the inner lining of the bladder. And it's essentially sort of the original immunotherapy. We've heard a lot in a lot of different types of cancers in the last 10 or 15 years about the immunotherapy revolution, but we've been using this in urology for over 50 years.
So BCG therapy sounds fantastic, but my understanding is there's a shortage. Is that right?
So unfortunately, despite being one of the most effective medications to treat bladder cancer, in the United States, we've had a considerable shortage of BCG off and on over the past 10 years or so. And what that can mean is some people that would be best treated with BCG may not be able to receive it.
Why is there a shortage?
Well, the manufacturer is not making enough to provide all the medication doses that are needed for all the people in the United States that have bladder cancer. Now, they are making some strides towards improving that. Obviously, there's a lot of research going on to identify effective alternatives or replacements for BCG. One of the companies that creates BCG is building a new factory to increase their production of it. So I'm hopeful in the next 5 years we'll have a lot less of a problem than we have had in the last 5 years. But I can say it's really disconcerting to be sitting there and be told that you have bladder cancer and you can't have the most effective treatment for it because we don't have access to it.
That's tough. Are there cases where BCG treatment doesn't work? And if so, what is the next option then?
So unfortunately, there are cases where the cancer will come back. And thankfully, I think 2026 is probably the best time in human history to be alive with that problem. Historically, the only treatment option that we had that was effective for people when BCG doesn't work were to surgically remove the bladder. which is obviously a pretty big impact on one's quality of life. But thankfully, there's really an explosion of new drug development. And now we have 4 or 5 different options that we could use as second-line treatments for people to wash inside their bladders. There are chemotherapy treatments. There are genetically engineered viruses. So there's some treatments where they've taken the genome for a typical cold virus and instead put in genes for cancer-fighting chemicals. So when we place this medicine in your body, it creates a bunch of chemicals to fight cancer.
Wow.
There are several different drug delivery platforms where they've figured out ways to let the medication stay in the bladder longer than an hour or two to expose the cancer to more treatment. And we're seeing great responses with that type of medication delivery as well. So a lot of good options for people.
That's fantastic. Now let's get into muscle invasive cancer. In what ways is that different from the kind of cancer we've been talking about up until now?
So the muscle layer is the second layer of the bladder wall. That's what squeezes when it's time to pee, to get the urine out. And we know that when cancer gets that deep, we can no longer effectively treat it with bladder washings. So the treatment is vastly different than for people that have it only confined to the bladder. And traditionally, that's when we're talking about things like IV treatments like chemotherapy, radiation, or surgery to remove the bladder.
I also understand that chemo and immunotherapy can be used together to treat bladder cancer. How does that work?
Well, they work in different ways, and they kill cancer cells in different ways. And I think the best way to think of it is it's kind of like in a boxing match, you got a jab cross, and you hit the cancer 2 different ways. Hopefully this one will kill a lot of the cells. This one will kill a lot of the cells. But when you put them together, you have an overall higher treatment response. And the most effective combination we've ever seen for the treatment of bladder cancer is an immunotherapy called pembrolizumab and a targeted therapy called enfortumab vedotin. So it's a molecule that searches around your body and will only bind to cells with a specific protein on it. And this protein is usually present on bladder cancer cells.
Wow.
Then when it finds that cell, it gets taken into the cell. And once it's in there, it releases a small molecule of chemotherapy.
Wow.
But this allows us to give this medication to people with a lot fewer side effects than we typically see for chemotherapy. Because again, it's not attacking all your cells in the body, but it's kind of searching and destroying only the problematic cells.
When those kinds of treatments are provided, can the patient keep their bladder?
Occasionally. That's a fairly nuanced discussion. So obviously many patients are interested in being able to save their bladders, right? And in many cases that's possible, either with medications or medications in combination with radiation. But there are some bladders that just simply aren't worth saving. I would say the typical treatment for muscle invasive bladder cancer does involve surgically removing the bladder and rerouting the urine in a different way.
What does that procedure look like?
Nowadays, it's nearly always done after a period of IV treatments first to help shrink the tumors. And we will remove the bladder in women and usually the bladder and the prostate in men. We would then remove some lymph nodes in the pelvis to check for any microscopic spread of cancer. And then we've got to figure out a new way to reroute the urine to get it out of the body. And there's 3 different ways to do that, but all of them involve harvesting a piece of the patient's own intestines and using that as a new path of egress for the urine.
So once a patient is in remission, how do you keep an eye on potential recurrences?
It depends on a number of factors. What was the initial stage of their cancer? How many times have they had it? Is it high or low grade? And for people that have bladder cancer that was only in the bladder, we generally monitor those patients with a combination of cystoscopy exams a few times a year, urine tests, and some CT scans from time to time. And for more advanced disease or people that have had chemotherapy, radiation, or bladder removal surgery, those patients we monitor with CT scans and blood work.
Are there certain things you advise bladder cancer survivors to do to reduce their risk of recurrence in the future?
Absolutely. And I think the best way to think about this is I tell people, if it's good for your heart, it's good for your bladder. I mean, obviously don't smoke. So people that are smokers, we ask them to quit. But the more you can get regular physical exercise, and that includes walking, it doesn't need to be CrossFit at the gym, eating a balanced diet, all these things are important for having a strong immune system.
What are some of the best things folks out there listening can do to reduce their bladder cancer risk right now?
Well, certainly don't use tobacco products. And if you do, quit. If you are in an occupation where you're exposed to certain chemicals that we know are associated with bladder cancer, I think wearing a mask or trying to do those things in well-ventilated environments are important. And then drinking plenty of fluids. The more dilute you keep your urine, the more dilute any potential toxins that are in your urine will be. And we think the lower your risk of developing bladder cancer.
Well, Dr. Lyon, thank you so much for joining us today. We really appreciate your expertise for breaking down everything into digestible bits and pieces. And I personally feel like I understand my bladder better and I appreciate it more. Thank you so much, Dr. Lyon.
It was really a pleasure to be here, and I enjoyed our conversation. Thank you for the opportunity to teach people about bladder cancer.
Thank you. So, one of the most effective treatments for bladder cancer is chemical washes. These are liquids that are inserted into the bladder and held there for a few hours while the treatment does its work. One of the most effective ones is BCG, but there has been an ongoing shortage of this treatment. However, researchers are developing alternatives and additional types of chemical washes and viruses in hopes of providing more treatment options. There are also some really effective combinations of chemotherapy and immunotherapy that can identify just the bladder cancer cells and deliver chemo to them without harming other cells in the body. However, in more severe cases, it may be necessary to remove the bladder and find a way to reroute the urine that works best for the patient. If you want to reduce your risk of bladder cancer, avoid smoking and chemical exposures, eat a healthy diet, get regular exercise, and make sure to stay hydrated. Remember, if it's good for your heart, it's probably good for your bladder, and maybe even the rest of your body as well. Okay, that's all for this episode, but if you've got a question, a topic suggestion, or a follow-up question about this episode, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Health Matters episodes and resources, head to mayoclinic.org/Health Matters. And if you found this show helpful, please subscribe and make sure to rate and review us in your podcast app. It really does help others find the show. Thanks for listening, and until next time, take care and stay healthy. This podcast is for informational purposes only and should not be relied upon as medical or legal advice. Always consult with a qualified healthcare provider for any medical questions. The appearance of any guest does not imply an endorsement of them, their employer, or any entity they represent. The views and opinions are those of the speakers and do not necessarily reflect the views of Mayo Clinic. Reference to any product, service, or entity does not constitute an endorsement of or recommendation by Mayo Clinic.